Happy Friday, everyone, and welcome back to another episode of NHLN Opinion Plus, a weekly series airing every Friday. This is a space for opinions where we talk about current events and questions the Latino community is curious about. Today, we are joined by Cliff Simmonds, Executive Director of the New Hampshire Children's Trust. Simmonds joined the organization's leadership team in 2019 with 25 years of nonprofit experience. Welcome, Cliff, and thank you for joining us this week.
Thank you. Thank you so much. I'm so excited to be here.
It's a pleasure, yeah. I was hoping to start off if you could give us a brief introduction to New Hampshire's Children's Trust.
Absolutely. Yeah, the New Hampshire Children's Trust actually kind of evolved as a quasi-governmental organization a decade or so ago. And what our primary mission is to prevent child abuse and neglect in the state of New Hampshire. And we do that through strengthening families. And so really our vision is to eliminate child abuse and neglect in New Hampshire. And our mission is really to strengthen those families and provide the resources that they need in order to really be a thriving family, a successful family in their communities.
Okay, thank you for that. Excuse me, my voice today. Could you tell us a little bit about the history of it? Because this is a chapter, right? Or sort of, it's a national organization with other sort of smaller parts.
Well, we have affiliations with other organizations. We are the Prevent Child Abuse America state designated organization. We're also designated as the Children's Bureau, which is a community-based child abuse protection grantee. So we bring a lot of the funds in for that. And we're also within the state, we're considered the facilitating organization, which there's a lot of terms that the state uses, but what this does is allows us to work with our network of family resource centers throughout the state to bring funding and support to them so that these resources and services can get to families that are in need.
Okay, right. Thank you. That was a great explanation. So sort of looking at how the pandemic has really affected the organization, what sort of ways have you seen the organization respond or adapt to it? And whether it was to continue operations under COVID-19 restrictions, or if you've been able to address new community needs that have arisen since then.
Yeah, that's the question that's always asked, and it's such a valuable question. And for us, it actually catapulted us into doing more work. We have been so busy trying to work with our family resource centers and making sure that supports get out to families. And when the pandemic first hit, it was frightening because we saw calls for neglect and abuse drop off the map, especially when the schools closed. And we know that because the teachers really have eyes on kids mostly. And we had to be very creative about how to keep eyes on kids and how to keep families resourced and safe and keep those basic needs for everybody as we were going through this really incredibly frightening and unscripted time. So we have pivoted and shifted what we did a lot to virtual work, which a lot of people have done. But when you're supporting family resource centers that are really built on doing direct service and direct work, it was very challenging for them. So we provided a lot of supports, even as simple as providing Zoom licenses for all of our family resource centers so that they can communicate with families and others. And then providing actually huddles for the professional staff, because we do a lot of support for professional staff because they were going through a lot. And how do we get to these families? And we know these families are in need. And so we provided those opportunities for the family resource centers to share virtually between each other and just for mindfulness with everybody and trying to figure out what can we do to keep children safe and families strong in the state of New Hampshire during this pandemic.
Right. You mentioned how it's a little harder finding these warning signs of possible abuse or neglect since children are no longer in school and are, sort of contacting people in person. How has the organization exactly been able to sort of work with teachers or any other people involved to sort of fill in this gap?
Yeah, so we're part of a cohort of folks that formed different agencies, state agencies, and community-based organizations that formed right in the beginning of the pandemic to talk about the idea of who, everybody plays a role. It's a whole system of child well-being here in New Hampshire. And so how does everybody's role interconnect and intersect in a way that we can get the word out to folks? So, our first thing was we do a lot of marketing communication around pointing people to where the family resource centers are and what services and programs they had. So we got out there as quickly as we could with some of that messaging. We have a pretty robust social media presence with our organization, but we also went to some of the old school type of messaging. We even created cards that could be put into that food delivery services could put into the takeout bags that just gave some, help is a click away. And just come to our website and there are places where you can go. So we were trying to be extremely creative with that. And the pandemic came in just before our April Prevention Month, which it's April Prevention Month now. And we use that to amplify the message out to people in any way, shape, or form we can to say, reach out to your neighbor, connect with a family member, see how somebody's doing. See if there's any need for help. These are all things that create community and help families work through things. And, if there is food insecurity, where can you get that food when grocery stores didn't feel like the safest place to be at the time? And so we were doing a lot of messaging and getting the word out there while other organizations were working with the education system and the schools and the teachers to think of creative ways when they were on these Zoom classrooms and how to speak with kids and, have time, that time alone where the kids could feel safe to talk about what they wanted to or needed to talk about as well.
Thank you for that. You mentioned this month, April, which I would love to talk about, how it's Child Abuse Prevention Month. Could you tell us a little bit about it, the importance behind prevention, and really how can residents get involved with this month?
Yeah, it's sort of an exciting time for us because we get to sort of spread our wings a little bit. And what we're trying to do is we're trying to help define prevention. It means a little something different to every person, right? And what we want to define prevention as we kind of say it tongue in cheek, but it's sort of the absence of something. It's sort of nothing, right? When nothing happens, right? That's what we want. A strong family is one in which, they're really hitting on all cylinders. They feel stable in their job. They feel stable in their homes. They have the basic resources they need. They have a sense of community or people around them, right? Everybody who's a parent knows that, parenting is challenging and hard. And sometimes you just need the advice of somebody else or the reassurance that you're not crazy because your 5-year-old is doing this. Every 5-year-old is doing this and it's okay. And this is some techniques to deal with it and the frustration or the stressors that come along with it. So we're really taking this month and every week we're highlighting a protective factor. So there are 5 protective factors that really let us know that a family's in a great position or a great place to lessen any kind of abuse or neglect situation, right? So, resiliency, that ability to just bounce back from something, some stress that's hard, right? This pandemic is a perfect example of how people are incredibly resilient. Just that, gaining parenting skills, where can you educate and gain parenting skills? I had mentioned like that sense of community and calling on a network of friends or neighbors or checking in on somebody and saying, hey, can I watch your kids for a half an hour while you finish up that meeting at work or anything like that can really help with those stressors. And, and then of course there's the concrete supports. And those are the things that we all need, shelter, food, those basic needs that we all need to have in order to feel that level of comfort and that lessening of stress that helps us get through our day. And then we really want to focus on the child and their social and emotional learning, right? So, and we know children that have strong social and emotional skills do better in school, they're better in their communities, they become more successful. So we want to make sure that we're building on that for the kids as well.
Right, absolutely. In your opinion and experience, switching gears a little bit, but how important would you say is community outreach and residents having equal accessibility to the organization's resources and services?
I think that's absolutely critical, right? And this is something that we have to get better at in New Hampshire, is this sense of the just the sense of getting this access to everybody. And this is where this family resource center model that we work with actually works very well. And there are 16 family resources through resource centers throughout the state, and probably 20 locations, because some of the centers have multiple locations, such as the Family Resource Center up in Gorham has 3 or 4 locations as it's more rural area. But I think what you're going to see is as we come out of this pandemic, this emphasis on working with all people, especially in rural areas, and making sure that we're getting equitable access to services for everyone. And I know it's top on everybody's list. It's top in the conversation. And I think we know we need to do better. And I think there are good plans out there to sort of transform this child well-being system to a more preventative system, where it will add access, or maybe not add access, but allow for greater access for all people in the state of New Hampshire.
That's great to hear. I'm hoping along with that, maybe if we can hear a little bit of your goals for the organization, either currently as we're hopefully recovering from the pandemic. I imagine some of your priorities from last year have shifted now, and now you have more time to maybe focus on reaching diversity, like diverse communities and stuff.
That's exactly it. And I think that's where our focus is going to be as we move forward. We know that there's going to be this sort of cliff effect that's going to happen as these emergency funds from unemployment, for food programs like SNAP are all going to eventually go back to, well, I hate the word to use, but go back to normal, right? Go back to the way they were. And that's going to be quite challenging for some families. And so we know that, and we know that in some communities, there's a greater level of diversity there, that we have to be able to reach those groups a little bit better than we are. And I think this is where the emphasis is going to be, sort of in our short-term goals, is trying to continue to reach those communities. And like I said, rural communities, especially because as they're more spread out, it's a lot more challenging to reach them and to get services to them. So we want to make sure that they know where these centers are, they know where these services are, and that we're providing the resources to and the support to the family resource centers as the Children's Trust, so that those family resource centers can really get out there and work with those families and home visiting. And we have programs for grandparents who have children, and parenting a second time around, and all of these great programs that are out there that all families can access if they just know where they are. So hopefully we'll get some greater visibility, and of course reaching out, having you guys reach out to us is a huge way to do that, and that's what we're trying to do. And that's what April's about, is just getting the word out that there's so many great resources out there, and they're for everybody at any place and any time. We all know that everyone goes through those stresses. We all know that we could use a little support from here and there, and it's okay to go seek it. It's okay to find it. It's okay to count on somebody else and lean on somebody else every now and then, while you're adjusting to this new change that we're going to be going through over the next 6 months to a year.
Right. Well said. That was, you covered so much, really. Thank you so much for your expertise and coming on here and having this time to sort of delve into what happened last year and how the situation is right now. We appreciate your time. Thank you so much for talking with us, Executive Director Simmons, and for being our guest on NHLN Opinion Plus.
Well, thank you very much. I really appreciate the opportunity to share what we're doing and your interest in it. Thank you.
Of course, it was a pleasure, and it went by very quickly.
That it did.
Everyone, please tune in next week for another episode. You can follow us on Twitter at NH Latino News and Instagram at NH_Latino News. I'm Belen Dumont with NHLN Opinion Plus, and I will see you all next time.